Kia ora, talofa and welcome. I'm Dr. Janine Bycroft, and this morning I'm delighted to introduce you to Erik McClain. Erik is a medical specialist working at Waikato Hospital, and today we're going to be talking about serious infections and sepsis. Erik, can you just explain a little bit about if I'm a mum and as a daughter and as a colleague, what are the signs to recognise that someone's really unwell?
Sepsis is one of those, anybody can get it. It all starts with just a simple infection, in particular bacterial infections, but you can get it from viral as well. You have to think about who's most at risk, so young kids, the elderly, people with diabetes, heart disease, emphysema, or other medical problems that can lower their immunity. First signs you need to look for are really the first signs of any infection. Do they have a fever? Is their heart rate fast? Are they breathing fast? Do they feel weak? Have they gone off their food? Are they not peeing as often as they were? Do they feel dehydrated? Is their blood pressure low? Do they feel dizzy? Are they confused? These are kind of the things that we all kind of look at the first signs of infection. It's up to the GP to decide, man, could this be sepsis? And everybody should be asking themselves, could this be sepsis? So that's what we would expect from the GPs to look at. And then they get the labs and they check and see, are the organs working? And then they assess for what kind of infection this is and if antibiotics are appropriate.
Okay. So perhaps can you explain what is sepsis?
So sepsis is where the body can no longer regulate its own response to infection, and it can lead to organ failure and death. And that's the simplest definition. Ultimately, the process that the body uses to protect itself, it starts hurting itself after a period of time. And that can be a really short period of time, or it can be days of an ignored infection.
Right. So the three big things we think about is meningitis or influenza. How does someone differentiate between someone's got the flu and they just need to rest and they'll get better over maybe a week or so, and actually this is a serious infection or potentially sepsis or meningitis?
Well, that's the real question, isn't it? Sometimes it's going to be hard to tell. If it's flu season and somebody comes in, maybe a slight cough, slight temp, muscle aches, and myalgias that has a course that it gets bad over a couple days and then slightly starts to get better, that's probably a viral illness. That tends to be the course that most people have. But how can you tell if it's just a common cold or if it's the beginning of pneumonia? Well, things like oxygen levels, how fast is their breathing, how bad is their fever? What do they look like? GPs are excellent at looking at a patient and saying, ooh, this guy looks sick. So it's really up to the GP to figure out. You can get lab tests and see. Most viral illnesses don't cause this massive spike of your white blood cells, but bacterial do.
Okay, but as a mum or as a colleague, how do I recognise that my child or a family member is potentially
My
really
suggestion
seriously
is,
sick?
first sign of infection, get them to the GP. Let the GP make that determination, because you always need to ask, could this be sepsis?
Right, okay. And how common is it?
Well, it's very common. In this country, we expect to see about 10 to 15,000 admissions a year for sepsis.
Wow.
Yeah, so it's actually quite common, and it's increasing every year. Dr. Paul Huggin at Waikato did a study over a 5-year period, which showed that we had about a 16% increase in sepsis diagnoses each year.
Wow. Okay.
So, yeah, it's we might be getting better at diagnosing it, and that's good. And we expect the numbers to continue to go up. We have also found that certain populations are higher at risk as well. Maori population has a 3 times higher rate of being admitted with sepsis. We find that people have a 20% mortality rate.
Wow.
So 1 in 5 people will die from an admission to a hospital for sepsis. If you get admitted to the ICU, that goes up to 30%, so 1 in 3. So it's good to ask the question and get treatment early, so that we're not one of those statistics.
Gosh. So for the public watching this, and what's the take-home messages about recognising serious infection or sepsis?
First of all, get your vaccinations.
Right.
That has been proven through all the literature. They don't cause disease, they protect against it. So get your vaccinations, especially kids and elderly. Get your flu shots and pneumovax. The next thing is take care of any disease processes you may have. If you have diabetes, take care of your sugars. If you're obese, lose weight. If you smoke, stop. These types of things. Take your medications as your GP has ordered. And if your kids, if your family member, if grandma starts to show any signs of infection, get them to the GP. It could be something simple and easy, but it could progress to sepsis, and you always have to ask that question. Could this be sepsis?
Okay. Fantastic. Hey, thank you so much for that
Thank you very
great
much.
summary.